Welcome back. As soon as we get sniffles, sneezes, and then a headache, we have that thought. How do I know if this is allergies, a cold, the flu, or possibly COVID-19? Well, here to help us distinguish the symptoms is Dr. Erin McNeely from Spectrum Health. Thank you so much for joining us this morning.
Thank you for having me.
It's our pleasure. So let's start first off, symptoms of the common cold.
Well, the common cold can be caused by one of many cold viruses and some bacteria. And we think of this as the runny nose, cough, sneezing, sore throat, fatigue, maybe low-grade fever, just kind of feeling unwell, symptoms that we're all familiar with.
Okay, and then now we know the whole talk out there right now about flu shots and stuff. So how about the flu? It's flu season.
Flu can be a lot like the common cold, but it's generally more severe. We think of higher fevers, a greater feeling of fatigue, that feeling like you've just been hit by a truck with the fatigue, and just feeling unwell. With the flu, people with underlying conditions like asthma, COPD, advanced age, they can become sick with a viral pneumonia as well from the flu.
Okay. And then now, on top of all this, we have COVID-19. Of course, everybody is extremely scared of this for the most part when it comes to when they get the sniffles and the headaches and that sort of thing. So talk about that.
Yeah, so COVID can be very similar to a lot of other common colds. In fact, there are other coronaviruses that are already in our population before COVID-19. And so you can have a lot of those similar symptoms like what I just mentioned. The difference is it can take a bit longer for COVID symptoms to start once you've been exposed. In flu, that's usually 1 to 3 days. And in COVID, it can be 1 to 14 days, usually around 5 days. So it takes a little longer after exposure to onset. And then some people do experience diarrhea with COVID, which is a little different from the common cold. Some flu cases have that. But then one thing that is very different about COVID is this profound loss of smell or taste. And not everyone gets that, but patients who do, especially if you have other symptoms, really should be tested because that is something that's very different with COVID.
And as far as those tests, people kind of want to err on the side of caution. So when do you actually kind of say, yep, it's time for me to go get that test for COVID?
If you have multiple symptoms, for sure, especially if you have that loss of taste or smell, if it's been kind of coming on over a few days and your fevers are on the higher side, flu tends to come on again a little faster. And definitely if you've known exposure to someone else. So that's 6 feet away, unmasked. A good example would be having dinner with a friend and you find out the next day or a few days later that they were diagnosed with COVID. And that would be a good time to get tested. We also generally test more aggressively people who are exposed to a lot of others, including people who might work in schools or places where there are vulnerable populations, such as nursing homes, hospitals, health clinics. Those folks, we want them to be a little more aggressive about getting tested because we know they're exposed to a lot of other people.
And of course, prevention is always key with a lot of these things. What are some main things we can do to prevent this?
Absolutely. We know from the past several months that we can stop the spread of COVID by washing our hands aggressively and wearing our masks. So hand gel is great. Carry that around with you if you have to go out. Anytime that you touch your face, move your mask. Before and after that, you should wash your hands with hand gel. When you do wash at the sink, I talk with my kids. I have little kids. We sing happy birthday, make bubbles, scrub for 20 seconds before you rinse and dry. So doing that very aggressively, wearing our masks. We know that in hospital settings and in clinic settings, we can take care of patients with COVID who may be very symptomatic, may be infectious, and we can be safe when we practice those measures.
And we have about 30 seconds left. If you could talk real quickly about the curbside flu shots.
Yeah, so Spectrum has over 40 sites now where you can go curbside and get a flu vaccine. You don't have to be a Spectrum Health patient. You can call Spectrum to get that set up. If you are a Spectrum patient, you can also get other vaccines that your kids may need that maybe they missed during the shutdown period. So we're really encouraging people to call us and come on out, get your flu shot. This is trying to prevent what some people are calling the twin-demic of COVID and flu. So far, flu cases are very low, even as we're seeing a rise in COVID. So do go out there and get your flu shots. The better protected we all are, the better off we'll be through the season.
Doctor, thank you so much for your time this morning.
Thank you.
Absolutely. Go to spectrumhealth.org to learn more and download their app.